Businesses, organizations, and others have suffered during the pandemic, with some coming out of it and others still struggling. An organization we're spotlighting today is with the YMCA. And with me is Heidi Brasher. She's a senior director with YMCA of the USA. Welcome, Heidi, to the program.
Thank you so much, Jeff, for having me here.
I have an interesting question. It might be an easy one for you. Do we call it YMCA, the YMCA, or what?
That is a great question. Most people just refer to us as the Y, their local Y in their local community. And so the Y is a great way to refer to us.
Okay, I can do that, and I'll remember that. The why. So we want to talk about what the why is. Let's go with this first question. Just how large of an organization is the why, and what impact does it have on the communities that you serve?
The Y is a nationwide network. So we have in more than 10,000 communities across the country, about 2,600 locations. That's every state. It's Puerto Rico. It's also the District of Columbia. So we're really wide reaching. And every year we serve more than 11 million people through the Y and programs.
So that would be all ages, I imagine.
All ages. Lots of folks like to say we're cradle to grave or birth to retirement, but we definitely serve really young ones in our early care programs, all the way through our older adult population.
Good information. Thank you. So let's talk about how things are going these days. Can you give a little history of the past 18 months, especially, during the pandemic and the pressure we have from that?
What a time. What a time for the Y. What a time for our communities. And really, the YMCA had an amazing opportunity to do what we do best, and that's serve our communities. And so as pandemic hit, as we all needed to change across the country, our YMCAs did as well. They shut down and immediately said, what do our communities need? Our communities needed emergency childcare. So more than 1,400 locations set up the next day as emergency childcare. Our communities needed food. They needed ways to access healthy food and continue to access healthy food. So we set up more than 1,200 locations in that space as well. And so we did what we do best and have done in our 170-year work that we've been doing in communities is respond to those needs, those ever-changing needs. And so we shut down business as usual and stood up what our communities needed these last 18 months. That's looked very different in communities across the country. Sometimes it was phone calls to seniors who were really feeling isolated and needed those connections because they couldn't come to a Y or another local organization. In other places, we really spent some time in our housing and made sure that we offered housing for homeless members of our communities to really be a part of a safe space during this time. In other YMCAs, again, those emergency childcare operations and our food programs were the highest need. And so we were able to respond as our communities needed.
Fantastic help you folks have provided, all those you impact. Let's talk about cleaning and disinfecting. Many who are going to watch this are involved with that, with ISSA. What did you do during this period of time to create and maintain clean, disinfected, safe environments?
Yeah, so that looked different as we progressed through this pandemic. And so I'll start way back at the beginning. And the work that we did setting up emergency childcare operations. We knew that we needed to work with the CDC and local and state officials in this space. And so immediately got on the phone with the CDC and really started to co-create procedures and plans for that childcare space. We were serving first responders, we were serving healthcare workers. And so how could we make that as safe as possible? And so they really leaned in with us and talked about cleaning of facilities, cleaning of program materials. They helped to talk about open air and circulation of our air, and really walked us through our full operation to ensure that we were looking at safety measures and guidelines. And so spent some time in that space for several months. In the summer, we really had the opportunity to bring back our day camp operations. So we took all of our learning early in the spring 2020, and we started to work with the American Camp Association. We spent some time working with a group called Environmental Health and Engineering. and brought together a panel of everyone from infectious disease specialists to industrial hygiene experts, pediatricians, anyone that could help us think through our programs in the childcare space, in the camp space, in our facilities, and say, how do we make this as safe as possible? Really those, what we call those non-pharmaceutical interventions, and think through what that looked like. That work with the Environmental and Health and Engineering Group has adapted and iterated as we've gone through this pandemic, and really has been able to support our local YMCAs, but also other industries who have looked to us as we started to set up programming. And we were able to do it in a safe way. We were able to keep our youth safe, our parents safe, our volunteers and our staff safe through this time. So those were some of the ways that we've done that, and really partnering with our local organizations, right? Again, those state and local officials that we worked with, but also organizations that could come in and help keep our buildings safe.
Well thought out plans for sure. My last question is, let's talk about schools. Schools are now back in session, or they're going to be very soon, and we're seeing infection spikes with children. What advice would you give to other facilities or organizations that serve the public, like schools, like the Y?
Yeah. So during this time, again, I mentioned we've been able to keep our members safe, our staff safe, our volunteers safe. And so there are a couple things that have really stood out for us in that work. Our biggest two measures that have helped for us have been our masking and our social distancing, or our distancing. We really spent some time thinking about keeping our programs in pods, in smaller groups, so that we could control any cross-contamination. We could control if there was an outbreak or a potential outbreak, some of that tracking that we needed to do. So that was a big piece for us. Maintaining hygiene is also very important in our programs, as it is in our families, right? So this is a great tip for parents as well. How do we help youth really understand, and our members understand, that proper hygiene helps in the spread of this? And so our staff got super creative and created fun hygiene songs for our kids, and really just doubled down in that space for us as an organization. And then thinking through some creative ways that we could do programming, taking programs outside, thinking about different space use, and really looking at the full scope of programs and how we could adapt in this time. And so those would be some of the things that, as we go into this fall and we work with our partners in schools, that we talk with them a lot about. We talk about our flexibility, having to move in and out as this pandemic has ebbed and flowed, and really thinking about doubling down when we need to on some of those interventions. But again, really working with the CDC and local and state guidelines.